connective tissue strap allows you to emulate the muscle strengthening effects of an assisted yoga spinal stretching routine. Now comes the very important connective tissue strap fixes. The connective tissue strap is sometimes referred to as the CT strap. The connective tissue strap routine, or an assisted yoga spinal stretching routine, makes all of the following chronically weak muscles strong as a group: upper trapezius, scapular division, medial zone, the bellies of all three divisions of middle trapezius, lower trapezius, medial zone, the bellies of all three divisions of latissimus dorsi, the belly of the spinal division of quadratus lumborum, and the belly of psoas major. The connective tissue strap routine and the comprehensive assisted yoga stretching of the spine are master fixes and make other seemingly unrelated muscles strong. I have intensively studied assisted yoga for 21 years and spinal biomechanics for 33 years. One result of these combined studies, along with muscle testing to find and make weak muscles strong, is the connective tissue strap routine. Using the CT strap regularly makes my back feel comfortable and relaxed and may do the same for you. I recommend that you do the CT strap routine gently 2 times per day if you are working at the computer all day. Our bodies need regular connective tissue stretching to create and maintain space for blood flow, lymphatic drainage, and nerve conduction, which makes and keeps otherwise chronically weak muscles strong. When your back aches at the computer, I promise you that what you are feeling is a result of weak muscles. The sections of adjacent muscles, which are strong, are being dramatically overused and abused in an attempt to compensate for these weak muscles. If you have any musculoskeletal symptoms or a previous medical diagnosis concerning your spine, ask your medical doctor, osteopath, or chiropractor if the connective tissue strap is safe for you. For instance, disc herniations may be made worse by using the connective tissue strap. It is very important that you do not use the CT strap where there is pain or cause pain using the CT strap. Using any more than a gentle force is not safe and may cause harm. Remember, by gently using the CT strap daily, over time, the connective tissue associated with your spine will become relaxed in a sustainable way. I have conclusively proven that gently using the connective tissue strap makes and keeps targeted chronically weak muscles strong. Resist the urge to use more than a gentle force. Also, only use a connective tissue strap exactly as I instruct or you may cause harm. There is no need to experiment with the CT strap on your spine. I have already done that for you. Focus on holding each stretch between 5 and 8 seconds. Older people may need to stretch for 8 seconds, while younger people may need to stretch for 5 seconds. It really depends on your current flexibility, not necessarily your age. This is my friend Christy. Thank you for helping me, Christy.
It's my pleasure.
Please have a seat right here. In assisted yoga and yoga, when connective tissues relax, the body moves a little bit. So, I'm going to stretch Christy to the side here. Let your body go all the way to the side. There we go. And I'm waiting for her body to relax, and there it went. When it went, I moved a little bit with her, following her into her lean. It's a very subtle body movement. As connective tissues relax, it can be seen in the mirror. So, when you are practicing with your connective tissue strap, start practicing in the mirror, watching for the connective tissue release so that you know when the technique has completed. Here we go. I'm waiting for the release. I'm waiting. There it went. We moved, yet ever so slightly. Same concept here. I'm torquing Christy's spine, pushing up on her spine, and I'm torquing her and I'm waiting. And there it went. Her body moved and gave just a little bit deeper into the torque. torquing Christy's upper body. I'm waiting for the movement. I'm waiting. There it went. It's very subtle, very slight, yet it is certainly there. And now for the connective tissue strap routine. At first, working with the connective tissue strap will be awkward. Soon, with repetition, it will feel as normal as brushing your teeth. By itself, this connective tissue strap section is an awesome addition to any yoga workout. This is micro-stretching of your spinal connective tissue using the CT strap to reach places you cannot reach and stretch yourself. In very simple terms, using the CT strap along the spine is like playing tug of war with your spinal connective tissue. It's all about creating opposing forces for pulling specific connective tissue apart, creating and sustaining gentle yet firm stretches. The CT strap procedures are part of the Quick Self Fixes routine, where we put all of the Quick Self Fix techniques together into a 15 to 20 minute routine. For now, review these connective tissue strap procedures repeatedly until you have learned them well. Otherwise, you will not be able to keep up during the Quick Self Fixes routine, which moves at a relatively rapid pace. First is a connective tissue strap procedure for the low back connective tissue. This technique stretches connective tissue in the low back, focusing on stretching the thick connective tissue called the lumbar aponeurosis. The lumbar aponeurosis is just underneath your skin, and it covers your entire low back area. It is thick and tough, just like leather. Restrictive tightness in this connective tissue is the most common cause of low back discomfort. When you use the CT strap, always move very slowly and be gentle. Do not cause any pain. Moving slowly and gently creates safety. We will perform this procedure 3 times in the low back, starting in the middle of the low back. Place a connective tissue strap ball, or not, in the middle of your low back between the top of your tailbone and the bottom of your rib cage. There's the top of the tailbone, here's the bottom of the rib cage. The ball placement goes right in the middle. The lamina grooves are on either side of the absolute middle of your entire spine and are actual grooves. Here are the lamina grooves. The ball placement goes just next to the very center of the midline and a little bit to the right, still on the spine. On my body, here's the bottom of my rib cage, there's the top of my tailbone. The ball goes between those 2 points. From the absolute midline of my spine, I go a little bit to the right into the lamina groove. There's your ball placement. People often place the ball too far to the side. Correct ball placement is essential. Stand with your feet shoulder width apart. Bring the 2 ends of the strap forward around your waist, inside your arms, and hold with both hands. Anchor the left CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the right CT strap away from the body parallel to the floor and diagonally to the right. You are not pulling the CT strap to the front. You are not pulling the CT strap to the side. You are pulling it diagonally, exactly between pulling to the front and pulling to the side. Next, lean to the right from the CT strap ball as you continue pulling firmly on your right CT strap diagonally away from your body. Pulling firmly does not mean pulling hard. Now, increase this lean a little by pushing your low back at the CT strap ball to the left as you bear more weight on your right foot. Keep pulling the CT strap right. Now, really elongate your spine by stretching upwards toward the ceiling. Lean backwards just a little bit to increase your stretch. Breathe and hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like connective tissue over your low back. Pulling your right CT strap diagonally to the right and pushing your low back to the left creates an opposing force, giving the low back connective tissue a very specific stretch. This is analogous to playing tug of war with a thick leather-like covering over your low back. Here is the same procedure for the other side of your low back. Shift the ball over the midline of your spine. Move the ball just to the left of the absolute center of your spine. Here we go. From the right lamina groove, there's the midline of my spine, there's my left lamina groove. Remember, the lamina grooves are on both sides of the absolute center midline of your spine. People often place the ball too far to the side. Stand with your feet shoulder width apart. Anchor the right CT strap by pulling it across the front of your abdomen parallel to the floor, keeping it at the same level with the ball on your spine. You've set your pin, now let's stretch against it. Pull the left CT strap away from the body, parallel to the floor, and diagonally to the left. Remember, you are not pulling the CT strap to the front, you are not pulling the CT strap to the side, you are pulling it diagonally. Lean to the left from the CT strap ball as you continue pulling firmly on your left CT strap diagonally away from your body. Increase this lean a little bit by pushing your low back at the CT strap ball to the right as you bear more weight to your left foot. Now, really elongate your spine by stretching your spine upwards and lean backwards just a little bit to increase your stretch. Hold this stretch for 5 to 8 seconds as you focus on stretching this thick leather-like covering over your low back. Replay this procedure twice more, performing it on the right and left, first at the bottom of your low back, just above your tailbone, and second at the top of your low back, just underneath your rib cage. You will repeat it here, and here, and here, and here. This completes the connective tissue strap for the low back connective tissue. This is the connective tissue strap procedure for the lower 20 rib ligaments. This technique stretches connective tissue along the spine, focusing on stretching ligaments which tie the ribs to the spine. Ligaments are tough, slightly flexible straps which connect bone to bone. Ribs are not fused to the spine. They have actual movable joints connected together with ligaments. Find the bottom of your rib cage and follow it to where it meets your spine. Place your connective tissue strap ball right above the bottom of your rib cage, just to the right of the very center of your spine. Stand with your feet shoulder width apart. Place the connective tissue straps on the outside of your arms, just above your elbows. Anchor the left connective tissue strap by pulling it across the front of your body parallel to the floor. This must be a gentle pin. If this pin is too tight, this technique does not work. You've set your pin, now let's stretch against it. Pull the right connective tissue strap diagonally to the right. From the connective tissue strap ball, lean your upper body to the right. Increase this lean by pushing your spine at the connective tissue strap ball to the left as you bear more weight on your right foot. Release a little more tension in your left connective strap now. Elongate your spine upwards. Keeping a firm tension in your right connective tissue strap, pull the right strap diagonally up and hold. Now, mildly rotate your torso left by pulling your right connective tissue strap gently forward and to the left. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. Hold this stretch for 5 to 8 seconds. Focus on tractioning the ribs away from your spine. Pulling your right connective tissue strap diagonally to the right and pushing your lower rib cage at the connective tissue strap ball to the left creates an opposing force that gives your rib ligaments an awesome and safe stretch. Here is the same procedure for the other side of your lower rib cage. Shift the ball over the midline of your spine into the left lamina groove, placing the ball just to the left of the absolute center of your spine. Here's the ball in my right lamina groove. I'm passing it over the center of my spine into the left lamina groove. Stand with your feet shoulder width apart. The connective tissue straps are on the outside of your arms just above the elbows. Anchor the right connective tissue strap to your body by pulling it across the front of your body parallel to the floor. You've set your pin, now let's stretch against it. Pull the left connective tissue strap diagonally to the left. From the CT strap ball, lean your upper body to the left. Increase this lean a little by pushing your spine at the ball to the right as you bear more weight on your left foot. Release a little more tension in your right connective tissue strap. Now, elongate your spine upwards. Keeping a firm tension in your left CT strap, continue pulling it to the left and diagonally. Now pull it up towards the sky. Rotate your torso to the right by pulling your left strap gently forwards and to the right. Lean backwards just a little bit to increase your stretch. Breathe deeply several times. And hold this stretch for 5 to 8 seconds as you focus on pulling the ribs away from your spine. You may perform this procedure at multiple levels going up your rib cage. This completes the connective tissue strap routine for the 20 lower rib ligaments. Here is a connective tissue strap procedure for upper rib ligaments and for neck ligaments. This technique stretches connective tissue along the spine, focusing on stretching the ligaments that tie 2 ribs to the spine at the second thoracic vertebrae. It also provides significant connective tissue stretching for neck ligaments and a thick leather-like covering over the side of the neck. Again, I remind you to always move very slowly, be gentle, and do not cause any pain. Place the CT strap ball in the right lamina groove of your upper back. Depending on the length of your spine, this may vary between 2 and 4 inches below the very top of your shoulder. For me, it's about 3 inches down from the top of my shoulder. The ball is placed right next to the center of the spine in the right lamina groove. Get that placement. It's very important. Now, stand with your feet shoulder width apart. Place the left connective tissue strap below your left armpit and anchor it by pulling the strap across your chest. You've set your pin. Now let's do the stretch against it. Pull the right CT strap diagonally up. Now pull the right connective tissue strap diagonally to the right. Turn your head to the right with your nose pointing toward the right connective tissue strap and keep it there. Now, elongate your neck by lifting your head toward the sky and lean your neck to the left by leaning your left ear towards your left shoulder as comfortably as it goes with the weight of your head. So here's the stretch. And hold for 5 to 8 seconds. These actions together create an opposing force that gently and safely stretch the associated connective tissue. Here is the same procedure for the other side of your upper back. Switch the CT strap to the opposite shoulder. Place the CT strap ball in the left laminar groove of your upper back, 2 to 4 inches below the top of your shoulder. Right here, very close to the center of your spine in the left laminar groove. Get that ball placement, it's very important. Stand with your feet shoulder width apart. Place the right CT strap below your right armpit and anchor by pulling the strap across your chest. You've set your pin, now let's stretch against it. Pull the left CT strap diagonally up. And now pull your left CT strap diagonally to the left. Turn your head to the left with your nose pointing toward the left CT strap and keep it there. Now, elongate your neck up by lifting your head toward the sky and lean your neck to the right by leaning your right ear towards your right shoulder as comfortably as it goes with the weight of your head. Continue to elongate your neck, continue tension in your left CT strap, maintain this firm tension, and enjoy this awesome stretch for 5 to 8 seconds. This is the connective tissue strap procedure for the low back. This technique stretches connective tissue, focusing on stretching the ligaments that tie the vertebrae to each other. This procedure also focuses on stretching the intervertebral discs. Discs are spongy cartilage pads between most vertebrae. This procedure is performed 3 times, starting from the very bottom of your spine. Always move very slowly, be gentle, and do not cause any pain. To begin with, place the CT strap ball at the very bottom of your spine, just next to the very center of your spine on the right, in the right laminar groove. Ball placement is very important. Right next to the very center of your spine, a little bit to the right, in your very low back. Stand with your feet shoulder width apart. Place the CT strap inside your forearms and elbows on the left and right, and hold the straps with both hands out in front. Anchor the left strap by pulling it across the front of your abdomen parallel to the floor. You've set your pin. Now let's stretch against it. Pull the right strap firmly out in front of your body and then straight up. It should be in line with your ear. It must be a very firm pulling here. Lean forwards from your waist up to 90 degrees, keeping tension in the right strap. Now, lean your upper torso to the left by pulling your right strap forward and to the left. And hold for 5 to 8 seconds, enjoying this deep low back tractioning stretch. When you come out of this stretch, come back to the midline for safety reasons, and then come up. These actions create an opposing force, stretching connective tissue in your low back by pulling the spine away from your pelvis. Here is the same procedure on the other side of your low back. Shift the ball over the center midline of the spine at the very bottom of your low back, going from the right laminar groove across the midline to the left laminar groove. Get that ball placement, it's very important. Anchor the right CT strap by pulling it across the front of your abdomen parallel to the floor. You've set your pin, now let's stretch against it. Pull the left strap firmly out in front of your body and then straight up. It should be in line with your ear. Now, lean forward from your waist up to 90 degrees, keeping tension on the left connective tissue strap. pull the left strap forward and to the right as you lean to the right, and hold for 5 to 8 seconds, enjoying this awesome low back tractioning stretch. As you come out of this stretch, come back to the midline for safety reasons, and then come up. Replay this procedure at 2 more spinal levels. First, in the middle of your low back, between the bottom of your spine and the bottom of your rib cage, right here, on my body, in the middle of my low back, on the right and the left. Second, just below my rib cage, on the right and the left. The connective tissue strap routine will only be learned through multiple repetitions. Have perseverance, and you will succeed. This concludes the connective tissue strap routine. Here are the guided neck stretch fixes. Take your connective tissue strap, place the ball on the top of your shoulder, hold each end of the strap, and pull toward the floor. This is cervical rotation, turning my head to the opposite side with cervical extension, pushing my head and neck backwards. Turn my head to the side and extend backwards, always elongating my neck. I take this hand and hold my frontal bone and temporal bone, and I pull to elongate, and I hold for 5 to 7 seconds. Here is straight cervical lateral flexion, bending my head to the side. This arm is pulling down, pulling this strap taut, keeping pressure on this shoulder, pulling down. I lean my head straight to the side, not forwards or backwards. At the very end, I take my hand and I pull up and over and hold for 5 to 7 seconds. And switch sides. Cervical rotation with cervical extension. I turn my head, extend my head backwards. I take this hand and I pull up to elongate my neck and pull backwards and hold for 5 to 7 seconds, relaxing into the stretch. The whole time, this hand is pulling down. Now comes cervical lateral flexion, leaning my head straight to the side, elongate my neck, lean to the side, and pull to elongate my neck and hold for 5 to 7 seconds. Now we have cervical extension. I'm going to hold my head not under my jaws. I'm going to hold behind my ears on my occiput and traction my head all the way up, tractioning my neck, and lean backwards and hold for 5 to 7 seconds. And now for cervical flexion, which is leaning forward, I hold my occiput not under my jaw. I traction my neck straight up and bring it forward, chin towards chest, and hold 5 to 7 seconds. Here is the occiput glide fix. This fix involves 3 distinct motions. One is my head's bobbing up and down. The other is my head is turning from the far side to the midline. And the third motion is I take my middle finger and I place my index finger and ring finger on it, just like that, for support. I place my index finger behind my ear, below my ear, just behind the mastoid process, which is a bony knot right there, and I drag that finger all the way to the midline. So all 3 motions at the same time. My head's bobbing up and down. My head's turning toward the midline as I drag my index finger to the midline just underneath the base of my skull. And now for the other side, same finger configuration, just behind the ear, below the mastoid process, that marble-sized bony knot right there. My head's turned all the way to the side. I'm bobbing my head up and down. I'm turning my head toward the midline, and I'm firmly dragging my index finger from the side to the midline, stretching thick connective tissue between the base of my skull and the top of my spine. Here is the cranial fix. Take your little finger, place it on your frontal bone. Take your ring finger, place it on your sphenoid. Take your middle finger, place it on your parietal bone. Take your index finger and place it on your temporal bone. Place your thumbs on your occiput and hold extremely light and extremely gentle. It's okay if the finger placement is not exactly perfect. This fix works anyway. Hold very gently, very tangentially, very softly. This is how to make 2 connective tissue straps, one from a beach towel and one from a sheet. Find the longest beach towel that you can find and cut a 6-inch swath in it. Wind the beach towel up, starting in the center, making a rope. The secret to a good strap is to have it super tight. Use your foot as a brace. Now, tie a loop in the center of the strap. Focus on keeping the knot in the center of your strap and tighten it up. Tighten it up super tight. There. This is my preferred connective tissue strap for using in the shower. The heat from the hot water on my back makes for a better stretch. I hang it over the shower head, and I'm in the shower looking at it, and I use it almost every day. Here's how to make a connective tissue strap from a sheet. Take a top sheet and cut a 2-foot swath in it. Now, wind it up, starting in the center. Wind it up as tight as you can. Use your foot as a brace. My protege, Greg Tinkle, who teaches yoga, helped me figure out how to make a new and improved connective tissue strap, and that's what we have here. Thank you, Greg. Once wound up tight, make a standard loop. Now, the piece that comes out from above goes under and through, and the piece that comes out from under goes over and through. Tighten it up, focusing on keeping the knot in the middle. Tighten it up as tight as you can. And here you have one of the greatest inventions of the 21st century. Top sheets have different thread counts. If it's a heavier thread count, a thicker sheet, your length may be less. If the thread count is less and it's a thinner sheet, you may need a longer piece. Play with it. Create a knot about the size of a large chicken egg. You are welcome to purchase connective tissue straps from us at quickselffixes.com or happily make your own.